report. So we welcome the study, and I want to say this, that although our top management are not here, they have commissioned the GRA staff here to receive the report, to listen to the presentation, and then present the report to them. Unfortunately, the presentation was done, an excise tax bill or excise duty bill was presented to Parliament. Now, Mr. Apao, with the head of the excise unit, is not here because he was just called this morning. Because the bill had been referred to this committee. They asked him to be part of it. What I want to say is that some of the findings of the work are already part of the bill. Because according to us, the work was completed some time back. And they also made some inputs to the excise bill. Now, aside those that are actually in the bill, there are also excise duty reforms. And most of the findings are actually part of that. And you know, the tobacco, alcohol, wines and spirits of course, they are also alcohol. Flavored water, carbonated drinks, sugar sweetened beverages, and even plastics. Now, when you take tobacco, for instance, it accounts for the illnesses. Tobacco-related illnesses account for about 3% of all deaths in the country. And it is costing Ghana 668 million every year, equivalent to 0.2% of annual GDP, to take care of the tobacco-related illnesses. You know something interesting? Alcohol consumption also cause harm to Ghanaians. I'm going to mention something that will surprise you. About 200 health conditions, 200 health conditions are related to alcohol consumption. So you see how harmful it is. 200 health conditions are related to alcohol consumption. Diabetes, another problem. We also have environmental problems associated with plastics. And so people cannot consume these commodities or products, and they don't know how harmful they are. So it is against this background that GRA, Minister of Finance, are actually using tax policies to see how we can reduce consumption of these products. And we do this using the excise duties, custom duty, value added tax, and even NPL, get fund. So GRA will continue to implement excise tax policies to discourage consumption of these goods and these products. But there's always some wins when you decide to use excise duties to discourage consumption of these products. There are 4 wins. What are these wins? Win 1, when you implement excise duties, win 1, you generate revenue. But that shouldn't be the purpose for the use of excise taxes. Win 2, you discourage consumption of these products. Win 3, you reduce healthcare burden. Healthcare cost burden, you reduce it. We've heard of Ghana Medical Trust Fund. What is it for? Mainly for NCDs, right? And these products are mentioned are the main cause of these the NCDs or these NCDs. And it is expensive to deal with them. Extremely expensive. Name them. The diabetes, the hypertension, and you can name them. Extremely expensive. So when you use the excise duties, what you are invariably doing is that you are discouraging consumption of these products. They don't get sick. Healthcare cost reduces. President had to come up with this bill, law, because of the situation that we faced. Then the last one got to do with to reduce the risk associated with consumption of these products. GRA implementing the excise duties has generated about 8.7 billion from 2020 to 2025. And for the revenue, it will always go into the consolidated fund, but eventually it will find itself also supporting healthcare. So all what I want to say is that it is our hope that the revenue accruing from these taxes will be used to support healthcare. In conclusion, I just want to say that you are all welcome. As I said, the presentation is to GRA officials. But those who are here with us, we are extremely grateful. We are thankful. Commissioner General is extremely grateful that you can form part of this. Proffer your inputs and then advise whatever. So we just want to say that you are all welcome. Support GRA, receive the findings, and whatever we want to do with the findings, eventually you will benefit. So on behalf of Commissioner General, on behalf of Commissioner Domestic Tax Revenue Division, on behalf of Customs Commissioner, on behalf of Commissioner our Support Services, I say we are all welcome. Thank you very much.
One of those two. That's good. So I hope this comes at the end of the day. Those taxes will be amount for health purposes. Now, to give us the next address is one astute man. The country is being in a public hospital for 2 decades, still fighting for our lives as people of Ghana, both locally, globally. Everybody find himself very passionate young man. And to give us that is Lord Abraham, Mr. Abraham Musa, the executive director for Bast Ghana and the national coordinator for the NCB Alliance now. Let's look.
So good morning, ladies and gentlemen, and I'm happy to stand for you today to also join Dr. Combat in welcoming you on this meeting. Distinguished, if it's important, I acknowledge the people, even though they're not here. So I will start by saying the distinguished Commissioner of Ghana Revenue Authority, Commissioner Domestic Tax Revenue, and also Commissioner Custom Division of Ghana Revenue Authority. Minister of Health is present here. One organization representative present here, the Federal Authority, including our way coming. Also representative of the Global Health Advocacy Incubator, our partners, and also Tax Assistance Network as one of our partners. I also want to acknowledge the presence of civil sector organizations here, and then also representative of the Ghana Revenue Authority and customer officials present here today. Also our online colleagues, and then also the media and esteemed partners, stakeholders, and ladies and gentlemen, good morning. It is with great pleasure and a deep sense of purpose that I welcome you all to this strategic stakeholder meeting on advancing tobacco taxation for improved public health in Ghana. On behalf of the board, management, and the center staff of the Vision for Accelerated Sustainable Development Bast Ghana, I extend our warmest gratitude to each one of you for honoring our invitation and for your commitment to this vital public health and fiscal agenda. We are particularly honored by your presence, by the presence of senior officials from the Ghana Revenue Authority and Custom Divisions. Your leadership in fiscal policy reforms, domestic revenue mobilization, and your ongoing collaboration with civil sector organizations beyond Bast Ghana in tax administration and tax governance have been instrumental, and we acknowledge that. We deeply appreciate your openness and partnership that Ghana Revenue Authority continue to demonstrate. Ladies and gentlemen, tobacco use, as has been said already by the combat, remain one of the most pressing public health challenge of our time. Similarly, alcohol, sugar-sweetened beverages, carbonated and fizzy drinks also worsen the problem. In Ghana, they contribute significantly to rising burden of communicable diseases, straining our healthcare system, diminishing workforce productivity, and imposing heavy economic costs on household and individuals, and as well as the nation. The health consequences are severe. The economic toll through increased medical expenditures, lost productivity, and premature deaths are unsustainable. Globally, the evidence is unequivocal. Excise tax is one of the most effective and cost-efficient tools for reducing tobacco and other unhealthy commodity consumptions. The World Health Organizations, particularly the Article 6, call on parties, including Ghana, to implement stronger price and tax measures to reduce the tobacco demand. In recent years, Ghana has recorded commendable progress, with the passage of the Excise Duty Amendment Act, which was passed in 2022, ahead of 2023 budget statements. However, current excise tax rates on tobacco products still fall short of international best practices. This leaves tobacco products and other agricultural commodities relatively affordable, undermining both public health goals and the full revenue potential for this policy for this policy lever. the forthcoming, which was read yesterday, mid-year budget, we felt that it represents a critical policy window, which I know Combat will give us some highlights on it. An opportunity for Ghana to align our excise tax, including tobacco, alcohol, and SSBs, taxation with global best practices, global standards, strengthen public health and protection, and enhance domestic revenue mobilization. It's again this backdrop that Devas Ghana commissioned and has completed a comprehensive evidence-based report titled Advancing Tobacco Taxation, Improve Public Health in Ghana. I mean, alongside other report that the WHO also came out with in recent times to advance tobacco and also SSB taxation and efforts in Ghana and across the globe. The report provides a thorough analysis of Ghana's current tobacco taxation landscape, synthesis, robust empirical evidence, and offers practical and actionable recommendation for reforming the excise tax structure. We believe that through constructive, evidence-driven dialogue, we can chart a practical path forward that advances both public health outcome and sustainable revenue for our country. Ladies and gentlemen, the success of the excise tax reform in Ghana hinges on sustained multi-stakeholder collaboration, and that's why we have key partners in our mix here today. Plus, Ghana remain fully committed to this collaborative approach as part of our broader mission to accelerate sustainable development through effective fiscal and public health, targeting tobacco, alcohol, sugar-sweetened beverages, and then also ultra-processed food, major preventable drivers of mortality and morbidity in Ghana and across the globe. Before I conclude, I would like to take a moment to commend the Ministry of Finance, Ghana Revenue Authority, and all officials for the significant excise tax reforms announced by the Honorable Minister yesterday during the 2026 mid-year budget review. And like I said, talking about, we will highlight most unbelievable the points. Advanced Ghana, we are extremely encouraged by this development, many of which align with our long-standing advocacy for stronger fiscal measures to protect public health and improve domestic revenue mobilization. Notably, we are pleased that the excise tax rate introduced in the 2026-2023 budget statements for sugar-sweetened beverages have largely been maintained, except for locally manufactured fruit juice, which there was an exception on that. Though not particularly happy, but I think for us it's okay because the other tax rates have been maintained. Right. Ultimately, and what matters most for us, is effective implementation and enforcement of the policy. And I'm happy that we are gathered here to discuss that. While we celebrate these important advocacy wins, there are still critical reforms that we believe deserve continued attention. This includes the introduction of a hybrid for also sugar-sweetened beverages, and then also a broader expansion of the excise tax to cover ultra-processed foods, which are increasing this burden, and also benchmarking the excise tax rate to inflation. I'm not sure whether that was done. Maybe Dr. Komba will tell us more whether if we were able to benchmark the rate to inflation, also to income growth. And we remain hopeful that the forthcoming bill will provide, which I'm told has been laid already, will provide further details on these reforms in coming days and create additional opportunity to strengthen Ghana's health tax framework. Thus, Ghana stands ready to continue working with the Ministry of Finance, Ghana Revenue Authority, the WHO, and also the Food and Drug Authority and all other stakeholders to advance evidence-based policies that protects public health while also safeguarding these policies from industry interferences as much as we can, and to ensure that we are able to support sustainable development. Once again, I thank the Ghana Revenue Authority,
and the leadership of Dr. Combat, who've been working with all these years in advancing our objective for your steadfast partnership. I also thank all partners and participants gathered here today for your presence and the expertise you bring to this table. Let us engage openly, constructively, and purposefully. Thank you so much for attention.
Thank you so much, Mr. Labram, for that remark. Well, before a policy is actually taken and action is being taken, there's a problem identified. We want to see what is the problem. Why are we advancing the cost of excise tax? Why do we want that to be strengthened? There's a particular problem that we want to solve. And for us to understand the context of that problem, we want to have a presentation on the burden of NCDs and the role of fiscal policies here in Ghana. So that much I want to invite the research and policy manager at Vast Ghana to help us with that presentation. Please let's welcome Mr. Godfred Tunibu Akudia.